And the point is that our bodies are made from Mother Nature. So when they're sick, you have to go back to Mother Nature to figure out what's happening and repair it. So I give the analogy of if you have a bicycle and your bicycle is broken, you could take it to the Ford dealership because they have some parts that look the same, like they have tires and wheels and chains and things like that. But those Ford parts do not belong on your bicycle. But the reason why drug-based medicine is so powerful is just financial. They take your money every week before you even see it from your paycheck, which is pretty wild to me. That I think is that the only industry that takes your money before you use them, and it's mandated by your employer and the government for your whole life, Medicare, Medicaid, your whole life, and uh, and then when you get hired, then you pay extra for your insurance through your company, and then any sort of other benefits, supplemental insurance. It's just wild how much money we spend every week, and it's forced out of out of our pocket. They don't do that with boats or cars or bicycles or tennis shoes or underwear or toiletries. They only do it with drugs. So you get easy access to drugs and medicine. So in my career, I've been doing natural holistic healing since 1997. I graduated from school then. Started studying nutrition in 1993. I've seen, I don't know, 40, 50,000 patient visits in my career. And I've been focusing on using supplements and diet only to repair people's situations regarding chronic illness. I use old and new clinical discoveries to solve complex chronic illness with only diet and supplements. I got a lot of medical doctor friends who are holistic. They use ozone, they use injections, they use peptides and EDTA chelation, which is all awesome. And I'm a big fan. But whatever works. And how do you know if something's working? There's labs. And my favorite lab is called MVX Plus. It just came out January 6th of 2025. It measures the 5 biggest, most important subjects within our bodies. And that would be infection, inflammation, toxicity, malnutrition. And they all cause mitochondrial dysfunction. So if your mitochondria don't work very well, then your body's going to fall apart. Your cells are going to die. Tissues, glands, organs, body dead because of mitochondrial dysfunction and the inability to make energy. There's a guy named Dr. No, Know, and he wrote a book about mitochondria and how they're affiliated with every chronic disease, including deep neurological situations like Alzheimer's and stuff like that. Hi Tim Scover. So and when I've done deep dives on different diseases, okay, such as autoimmune disease. So check this out. Back in the 1950s, all the doctors knew what autoimmune disease was caused by, and then they forgot. So we're talking decades ago, and I know this from all these old books I got behind my shoulder, these old nutrition and medical textbooks. I like to collect them and I read them and I learn from them because there's a lot of information that we've just forgotten, and it's not on the internet, and it's only in these books. So, for example, autoimmune disease is a chronic infection. It stays in the body for a long period of time. The immune system can't tackle it, and it's living there because of toxicity. Over the course of time, the immune system gets confused and overwhelmed, and it starts to attack the organ. So picture, you got like some kind of infection, and the immune system targets it, and it can't tackle it. It can't get rid of it, and then it goes after the it's sort of like a sniper bullet. Now it's got, I shouldn't say these words because it might get banned. Okay, but instead of using like a sniper bullet, it's using a shotgun spray. And again, that's not good enough, and the infection continues to thrive. And then the immune system just gets so tired and confused, it starts to go after the organ. So if you can have a virus in your thyroid, for example, or bacteria or parasite, and now your immune system is attacking the thyroid after a few years of not being able to tackle the infection. So that's a problem right there. That's autoimmune disease. So you have to get rid of the infection and the toxin. That's how you get rid of autoimmune disease. So in the meantime, people get symptoms. Their organs are falling apart. They get a lot of symptoms from an organ that is the signature of that organ. So heart symptoms, we know what they look like. Thyroid symptoms, we know what they look like. Brain symptoms, we know what they look like. And then the doctors treat those symptoms over and over and over again. but they're not getting rid of the toxin and infection. Those are the two main things. So MVX measures toxins, infections, inflammation, and malnutrition, all leading to mitochondrial dysfunction. So like you should, I have that memorized, and maybe you should memorize that too. Doctors should definitely memorize that. Toxins, infections, inflammation, malnutrition leading to mitochondrial dysfunction. So we should do that backwards. Mitochondrial dysfunction caused by toxins, infections, malnutrition, and inflammation. So let's talk about vitamin B1 a little bit. And I was reviewing this in the last week. I've done some presentations on stage. Like back in December, I spoke to 300 doctors on stage, and I talked about vitamin B1, and I listed out all the symptoms of B1 deficiency, and I have 70 symptoms in my presentation, and they're divided into categories: neurological, GI, respiratory, metabolism. When I say respiratory, I'm not just talking about lungs. I'm talking about in the mitochondria and hycoria. And so B1 deficiency causes heart disease, heart failure too. It's called beriberi. It can cause congestion of water in the lungs and in the ankles and swelling. And it's a terrible death when people have that. But when B1 was discovered in 1929, fast forward the next 30 years, 29, 39, 49, 59, yeah, 30 years, there was research on it. There was books written about it. And people use B1 more often, even into the 60s. But it was forgotten. And the reason why is because they're specialists. So you have 70 different symptoms that B1 deficiency causes. That's 70 different specialists, for example. Like you got heart specialists, liver specialists, GI doctors. You got the neurological doctors that focus on Parkinson's and Alzheimer's, and other neurological doctors will focus more on peripheral neuropathy. All that's a B1 deficiency to some degree. And then you got to look for toxicity and infection and inflammation and malnutrition. And toxicity, inflammation, infection, they all cause B1 deficiency. So there's these set principles that come together, and when you go after these set principles, you have tremendous improvement. And let's talk about hormones. So people have they use hormones. Really, I'm talking about reproductive hormones, estrogen, testosterone, even like growth hormone, and even cortisol, like from the adrenals. You can do stuff with those hormones and get relief. But then what? But then you got to still tackle the cause of why did somebody wipe out their hormones. So I just had that gas leak for a year back in sorry, I'm distracted. 2024, gas leak at my house. And man, I thought, is my testosterone low? Is it? No, it's actually higher now than what it was 2 or 3 years ago. But I think it was lower because of the toxicity. But whatever, like there's reasons why testosterone would be low. And it's not usually, it could be diet, but there's going to be other reasons too. There's reasons why women lose estrogen and progesterone. You can't just blame, their genetics or menopause or their monthly cycle. Like what crazy toxins and chemicals, metals, parasites, virus, bacteria, fungus, mold, yeast. Like what's the craziness inside their body causing the hormones to be so disrupted? So I got some good questions coming through, I think. How long? So, hi, Doc. I've been on Cellcore for a while now. How long does it take to rid the body of mucoid plaque ropeworm? It could be usually a few months, but I've seen it be 3 years. So you just have to keep going. Yeah, say someone is in ketosis 24 hours a day, 7 days a week. What nutrients do you find still need to be supplemented? Well, if somebody's in ketosis that long and they're doing very well, they could just stay in it for a long time. Then their body will kick them out after about a few years. maybe 3 years. So then the only nutrient missing, honestly, is sugar, fructose from fruit. So the body will kick out of ketosis. So you should eat some fruit and control that yourself, and then kick yourself out of ketosis. Do it yourself, and then go in and out, cycle. You want to cycle ketosis, which is something nobody really says. When keto was popular in 2015, 2016, 2017, people got really grumpy on ketosis, which I totally understand. And then you gotta get out of ketosis, and maybe you'll be less grumpy. You can come, get the glycogen back in your muscles, feed your brain a bit, then go back into ketosis and kill off cancer cells and do all the great things that ketosis does. So Nancy says I came off Cymbalta probably too quickly, but anyhow, I have tons of good source supplements that to say look to holistic first. Yeah. So I've gotten a lot of people off antidepressant medications. And there's a lot of work to be done there, but it can be done within 2 months. And I don't prescribe drugs. I don't take people off drugs. It's not my license. I'm a chiropractor. But there's reasons why people need antidepressants. And a lot of it has to do with diet. And a lot of it has to do with not eating enough meat. And then there's people who they need antidepressants because their glands aren't working very well. So there's supplements for adrenals and brain function and sleep. So like antidepressants, it's like that's such a symptom-based, medical therapy. I think, and 25% of Americans are on psychiatric medications. That's a ton of people. And I've talked about this before, and people attack me like they need their drugs. Okay, fine, take your drugs, but why do you need it? And if you lost a parent, for example, and you got really depressed and you're crying, at some point, grief goes away. And it might be 3 months, it might be longer. And then, so I've talked about this before. You can then maybe just wait it out, and you don't need the Cymbalta because you just need some time to recover from grief. So, but yeah, most people don't need the antidepressants when they have correct nutrition. So, what's the topic, Doc? I'm talking about holistic healing versus drug-based medicine. So, TikTok says it's filtering some of my comments to protect the community's experience. It sounds like I got some attackers going on. Why does it make me smile? I don't know. How do you know the difference between releasing Para 1 Mimosa pudica versus ropeworm? So Para 1 from Standard Para 1 from Cellcore, one of my favorite products of all time, came out in 2016. It changed my practice. People are eliminating 6-foot ropeworms or 3-foot hookworms or tapeworms. How do you know if it's the actual product itself? That product looks like sandy color. It's sticky. It's mucousy. It's almost like chewing gum if you put it straight onto your tongue. And how do you know if it's coming out or versus the parasite? Well, depending on the color and the texture and the consistency, if what comes out of you is brown or white, then it's not the product. If it comes out looking like a sandy color and it's just a mucoid plaque looking thing, maybe it's the pill. Just have to use your eyes. Just put that Para 1 in a glass of water and see what it looks like. Compare that to what's coming out of you. Pedro in my field is totally holistic. I've been holistic since I knew I was holistic when I was 6 years old. How about that? And when I was going through school, I could think holistically. I grew up on a farm. You got to think holistically on a farm, to be honest. And so when I was in school, I was very much looking forward to charging cash, getting off of insurance, so that way I could control my relationship with my patients instead of having an insurance company control my relationship with my patients. So when I first started my practice, insurance companies were asking me how long treatments were going to be, but they never asked me if the person would get well. And I was like, Dad, this system is so crappy. So I was on and off insurance 3 times. I finally quit insurance November 1st, 2005. So it'll be 20 years this coming November that I've not taken insurance. So when you don't take insurance, you have to be holistic. You have to get people well. And my path has taken me down this certain way, which then is validated by this test that came out in January called MVX Plus. Nancy says I sleep now for 24 to 36 every couple days. So you're sleeping too much. So you got to run some lab tests, check your thyroid, run MVX Plus, but something's going on to make you so fatigued. And it's the same reason why people don't sleep enough. How do you fix non-diabetic hypoglycemia? That's a really good question. And I just had a friend call me today. We were talking about this because he's got that. And he's not diabetic. I mean, his blood glucose is a little bit high, but he crashes so hard every day, like 1 o'clock. That's toxicity. And I used to check this out. When I was a kid, I loved fruit. And when I was first in practice, there was a fruit stand down the road from me. So I would have like 5, let's say, plums. I would sleep for an hour just from eating 5 plums. And I was poisoned on the farm. I grew up on a farm, and in 1994 or early 90s, 92, I got poisoned by parathion, which is a pesticide. It killed one of our neighbors. So this guy was pouring parathion, and he had a little bit fell on his engineer boot, which was thick leather with a steel toe. And he thought he'd be okay. He died that night. Parathion, look it up. It's banned in over 100 countries, but not in the United States. So the way I got exposed to it, I walked underneath the corn sprayer. That parathion was diluted 5 parts parathion to 200 parts water. Now, my neighbor who died from it, it was not diluted. It was concentrated. So anyways, I walked under this corn sprayer, walked under it. One of those big, tall, looks like a spider, going through the fields. And one drop fell on my back. And the guy that I was working with, he freaked out. He's like, dude, you got to, take your shirt off, wash it off. We had fresh water. So I washed it off, and he said, okay, you should be fine now. But so then I got back on the tractor, went to the next field, and I fell asleep, which I never did ever in my life. Like in the middle of the day, fall asleep, I'm like, it just never happened. So then he arrived, he sprayed the field, came back where I was located. And then I got off my tractor and I felt like I was high. I've never used drugs in my life, but I know what it feels like because I was high from parathion. So that really affected my health. And so fast forward years later, I had trouble with handling sugar and being sleepy and whatever. And I started detoxing. And within 3 months of that detox program, which was, 2004, 2005, I quadrupled my pull-ups and my push-ups. My endurance was so much better because I was detoxing parathion. So anyways, that's my long answer to your short question. How do you deal with non-diabetic hypoglycemia? You got to find out it's either infection or toxicity. So your first step would be to run MVX Plus and find out, is it toxicity or is it chronic infection? Hi, Bill N. in Chicago. I forgot to share last week the Reuteri ended my midlife of the night panic attacks. Okay, that's an amazing story. So L-Reuteri is a probiotic now being promoted by Dr. Davis. He's amazing. You can check him out. He has this YouTube channel. And in his lifetime as a doctor, he finds these really simple, very inexpensive ways to fix problems for the whole country. Like I'm talking about the United States, but of course it applies for anybody who needs it. But like in the United States, 98% of Americans are deficient or they do not have L-Reuteri in their gut. The L stands for lactobacillus. And then you got reuteri as a subspecies within lactobacillus. It's like saying dog, Pomeranian. We're saying lactobacillus reuteri. And you turn it into a yogurt so that you can amplify the quantity of L-Reuteri, and then you eat the yogurt. So this guy that I'm reading his comment, he's saying it fixes panic attacks at nighttime, which are terrible. Panic attacks are terrible. So, but I've had people say that it's fixed their SIBO, their gut, their sleep got a lot better. I personally had tremendous improvement in my sleep. So the autonomic nervous system works at its best when it's balanced and charged properly. That's a great statement. And what's the best nutrient for that? Vitamin B1, without a doubt. Vitamin B1. So I've been doing parasite cleansing with ivermectin, fenben, or menben. As a preventative for my tongue mouth, I chose not to be cut without any scan. Have any suggestions? Yeah, I mean, those parasite drugs are good for a period of time, just like the parasite supplements. You can use them for a while, but then at some point you don't need them, Nancy. And then you got to find out, well, what's the next step? So run MVX Plus and find out, do you have to detox next? Are you eating enough meat and getting enough protein in your body? Are you digesting the meat and getting enough protein that way? Are you eating, too much sugar? Do you have other problems? Is there mold? So parasites are pretty popular to talk about right now, and they should be. Everybody should have a hyper awareness on parasites, hyper awareness, because they are so tremendously, toxifying, and not everybody, but most people have them. So then once you take care of them, then what? Go pivot to the next step. Are you also using the binders while cleansing? Yeah, Cellcore binders. Yeah, Cellcore is great. Specifically carboxy. Made the biggest difference in your energy. The Shalom, that's an amazing. Oh, I got Shalom and Nancy talking with each other, interrupting your conversation. But carboxy is amazing at bringing energy up. It's also very detoxifying. So I've had a lot of people take that. I've maybe 1,000 people. And personally, when I did a video about this. When I took carboxy the first time, my gut was like so bloated. I put that carboxy away, and then I didn't touch it for almost a year. Then I talked with somebody who took carboxy and it changed her life. She lived in a moldy house. It was so bad. Her and her fiance, they lived together. They split up after a few months because the house was moldy and it made him violent. Mold can really change your personality and make you cry or make you not sleep, and anxiety, and it's terrible. So she took carboxy. Within 3 months, she was back to normal. When she told me that, I was like, wait, I need that. I need it. I took it that one time and I got super bloated. So then I took it a high dose, a little tiny dose. And the next morning I woke up and I went to the bathroom. And it smelled like a dead animal came out of me. That was carboxy. It gets rid of dead cells, mold. It gets rid of everything. So carboxy. There's a Russian doctor in Europe curing people from all incurable diseases, including Lyme. Dry fasting is the answer when done properly. Dry fasting is amazing. Yeah. I've never done it, but I've seen pictures of diabetic neuropathy and infections, gangrene in the feet, going away in 5 days because of dry fasting, or longer, maybe 7 days. I would recommend having that be supervised. Yeah. So dry fasting. Are you familiar with the? Okay, good. I gotta move on. Ask me more questions about healthcare, natural healthcare versus drug-based medicine, and your own personal conditions if you need to. I have dental issues, 2 more root canal teeth to be pulled, but also I wrote about a biopsy on my tongue that showed severe ulcerative epithelial dysplasia. I'm not wanting to be cut in my mouth. Oh, but Nancy, don't be afraid of getting cut in your mouth if you have a cancer on your tongue or in your mouth. I mean, if it's just dysplasia, then that's not a cancer. But if you have 2 root canals, yeah, I would pull those out, get those infections out of your mouth. And I'm not saying that they're infected, but usually they are. So All right, let me get back to what I was originally talking about. So, what I was originally talking about infections and toxins being the root cause of autoimmune disease, but also when I did a deep dive on cancer for about 2 years, I also found out that there's a guy named Dr. Simon Yu in St. Louis, I think. YU. Last name is YU. Simon Yu. Preventionandhealing.com is his website. He's amazing. He's an internist and he talks about cancer, but he doesn't try to cure it. He's not an oncologist, but he goes after the causes. And those causes would be toxins and infections and root canals, infections in the jaw. So he'll get people he'll put them on ivermectin and fenben, but he doesn't really eliminate worms. And I talked to him about that and I said, do you get worms coming out? And he said, no. I said, well, have you heard of Para 1 and Para 2 from Cellcore? Because I get people getting worms out. And he whips out his phone. He starts typing, what's the name of the company? And I don't know if he's using them or not, but he also, and he does electroacupuncture for testing, electrodermal screening. This technology came out of Germany in the 1950s. So he'll do the screening test, and he'll put like this electrode on the fingers, at the tips of the fingers, and find out, oh, you have a dental problem, or you have parasites, or you have toxins, and he'll detox people. And I've seen him give presentations, and the cancers go away, or the cells die that are causing the cancer, and he'll send people oncology once they've gotten rid of the parasites. Anyways, I did this deep dive on cancer, and I thought, well, it's mold, parasites, and with an underlying toxicity, and bacteria. Mold, bacteria, parasites with an underlying toxicity. So I'm saying like all of this stuff is like related to MVX Plus. This lab test is amazing. And you can get it from my website, upper right corner, click on MVX Plus or MVX Test, but maybe get your own doctor to run MVX Plus. That'd be amazing. We need more doctors to run MVX Plus. So when I also did a deep dive on heart disease, there's a supplement called NanoBactX, and it gets rid of toxins and infections. And I've seen that lower the coronary artery calcium score. And there's a form of heart disease where the heart muscle is filled with toxins. And in the studies that I've looked at, you can have 22,000 times more mercury in the heart than a normal heart, or cadmium, or tin, or lead. So yeah, you can have toxins in the heart causing a form of heart disease, or you can have an infection in the heart causing a form of heart disease. You can have plaquing, like the cholesterol plaquing in the heart. There are dead white blood cells and dead skeletons of bacteria and viruses in the plaquing. Like macrophages turn to foam cells in the plaquing. So if you have the more infections you have in your body, the worse off you're going to be with plaquing in the heart. So the sicker you are, the more plaquing you're going to get. I got a patient now, he's a total mess. He's getting serious plaquing. He had a heart attack 10 years ago, but he lives in a moldy house. So he bought a RV to live in his driveway. And guess what? The RV is moldy. He's a mess. And it's like, oh. But yeah, I mean, when people, you can have somebody who's 6 years old, athletic, good VO2 max, and they have a heart attack and they're dead. Why is that? Could be malnutrition, mineral deficiency, and it could be a plaqued artery from an infection. It's not just LDL. LDL cholesterol was originally, supposed to be like a generalized risk factor. But then cardiology said, no, it is the only risk factor. It is the only cause. Not at all. Not even. When I had mold toxicity in 2016, I got 4 EKGs that year. I went to a cardiologist twice. I went to urgent care twice throughout 2016, like, geez, oh, Pete. And then, okay, hear me out. And then in 2024, with the gas leak, I went to urgent care twice. I went to ER once. And it's like, well, have you ever had a history of heart disease? Yeah, like it's from mold and from the gas leak. But okay, let me back up. I got interviewed for life insurance recently. And that was their question. Have you ever had heart disease? Well, yeah, I went to the ER and I went to urgent care because of mold and because of the gas leak. And they're like, but have you had heart disease? It's like, yeah, my heart was hurting, my blood pressure was up, I couldn't breathe, my ankles were swollen, my left leg was swollen, my left arm was swollen. I thought I was having strokes from the gas leak and from the mold. And they couldn't understand. And they're asking, did you have heart disease? Well, what's your definition of heart disease? Plaquing in the arteries? Yes. That is your only definition of heart disease, is if you have plaquing in your arteries. It's stupid. Because people go to the ER with chest pain 60% of the time. It's not a heart problem. It's not like LDL cholesterol plaquing. It's mold, and they're breathing in toxins. It's like the gas leak. Maybe they work in a toxic environment. It's not just LDL cholesterol. Don't be so stupid. Get off the LDL cholesterol bullshit. Sorry. There's other reasons why people's hearts fail. There's other reasons why. And there's a cardiologist. There's a cardiologist who says, "Oh, LDL cholesterol is also linked to Alzheimer's." Oh, give me a break. Come on. Not everything is LDL cholesterol. Not everything is statin drugs. Statin drugs is like for 5th graders. So I got an emoji. I don't know what that emoji is. My teeth, okay. My teeth are bad now. I had 6 root canals years ago. Now I'm sick as heck with fillings, broken teeth, and oozing. No dentist can figure it out. Paid 19 grand Friday to get all bottom out to me tomorrow. Yeah, I see ducks. Yeah, it sounds like you're at that stage where you got to get your teeth pulled and get some dentures or some implants or whatever. But you got to get all the infections out. And I mean, the original reason why people get infected teeth is sugar in the diet. Like, that's the number one reason. So I'm 53. I have all my teeth, and I did not go to a dentist for 20 years because of low carb carnivore type diet. No bread, no pasta, no sugar. And the last time I went when I finally got a cleaning about 2.5 years ago, I had some tartar back here, like that, and that was kind of it. And otherwise, yeah, I'm all good. I did have a filling when I was in high school up here, and there was a bacteria hiding out back there, so I do have a little cavity currently untreated. So at some point I got to get that treated. But yeah, in high school I ate sugar and I drank pop and I got 5 cavities. So questions. You guys are Digestion. You got my CAC score down to 1. Yes, the number 1. My DO could not believe it. So I got your CAC score down to 1. I don't remember if I. That's cool. Yeah, you're welcome. I've had several people drop their CAC score. Last year I had a guy drop it 50 points in 6 months. I've heard implants are not great. Implants on the teeth are not great either and have lots of issues. That could be true. The bottom line is, with teeth, you got to eat the proper human diet. If you want to save your teeth, eat the diet that we're supposed to eat. That's a meat-based diet. Maybe some plants, maybe a little bit of plants, but your diet should be mostly meat. Like, if you have a dinner plate, half that dinner plate at least should be meat. Then the rest is plants. So therefore your calories are definitely mostly meat, but there's no bread on that plate. There's no pasta. There's no sugar. Like, in my lifetime, I've never purchased rice and brought it home. Sometimes I'll have it at a restaurant, but I don't order it. I've never purchased pasta and brought it home since 1999. And since 1999, I've purchased 5 loaves of bread, and that's it. And that was for experimental purposes. And you know what? back in chiropractic school, I had a full spine X-ray done, and there's a problem called spondylolisthesis. It's where like it was like L4 was slipped forward. You could see it was slipped forward. And there's also an issue too. I can't remember with the pelvis. Well, last year I went to a chiropractor. He did full spine X-rays, and that spondylolisthesis is gone. I reversed it. It's because of my diet. A meat-based diet will fix your spine and stuff like that. It's wild. And the other issue with my pelvis, gone. So we're talking 1994 versus 2024. How many decades is that? In those decades, I reversed the problems that I had with the original X-ray in school versus last year. Crazy. So if you want to preserve your teeth, eat a meat-based diet, low carb. So, man, there's a lot of questions here. Darren, this is from Lark. Darren, I'm 12 years sick, 5 now in bed. Lyme, dysautonomia, severe mold issues, flaxed from the antibiotic. Okay, road to heal. I have gained a ton and developed type 2 and worsening, but all meat causes severe IBS. Ideas. Yeah, good question. And I'm texting with a doctor friend of mine. She's got a guy on the carnivore diet, and it started plaquing up his arteries. And they confirmed that with labs and with ultrasound, which is wild to me because most of the time people do really well with meat. But if you're not digesting meat very well, I think if you have some rare genetic issue, then the meat can be bad. And I've said forever that meat doesn't cause disease, but there's going to be exceptions to all rules that I ever say. So yeah, in this case with this guy, he actually got plaquing from the carnivore diet. Like, what the heck? We have to dig down. I'm gonna work with her and talk with her about that in the future. I hope I'm gonna see her in August. Okay, but back to you, Lark. Meat causes severe IBS. Okay, so your gallbladder's not going to be working very well, and your stomach's not going to be working very well. You got to fix your digestive organs that are causing the IBS. So when you eat meat and you get diarrhea, why? What organ it needs the most help? And maybe it could be the small intestines, the first 3 feet, the duodenum. There's a problem there maybe with your microbiome. There's a lot of different potential causes of why you get IBS with eating meat. And so, Lark, make sure that your house is clear. No mold, no radon, no gas leak, no no dust mites, no. I had a patient once, he was sick. He had bed bugs. Yeah, and he was a vegan. So his regular doctor said, kill all the bed bugs and clean off your mattress and, do the things around the house. And I told him, eat meat. And then he did, and he got better. And then I saw him on the street like a year later, and he got these shoulders. He built shoulders. And I know his immune system got really strong. So anyways, you're caught in a catch-22 there with the eating meat and the IBS. You got to fix your body first. Icy Duck says, it makes me mad. I have told every doctor of 10 years now, I have no energy and struggling opposite of who I am. I was told perimenopause, menopause, fibromyalgia, depression, everything but teeth. Yeah, the teeth thing, that's, I'll tell you a story, Icy Ducks. One of my mentors, he was really sick in the 90s and he got better. And he told a story about, okay, he got parasites out, long, big parasites, big enough to put into a jar. And he sent them to a specialist to identify what the parasite was. He detoxed, he changed his diet. He avoided all carbs for 5 years, no fruit, no vegetables, just meat. And he had a tooth pulled that was infected. And it came out, the dentist pulled it out, and suddenly my mentor was really embarrassed for the dentist because he thought the dentist had farted. And he's like, no, wait, no, that's not what happened. And he's like thinking, did he fart? No, he didn't fart. Oh, It's from my mouth. The infection was stunk so bad. It was like, the dead bacteria and stuff. So it saved us, it really helped him out to get the infections out of his teeth, out of his mouth. Okay, so I'm talking about my mentor. So then what happened was he was teaching me and thousands of other doctors for many years about getting parasites out, detoxing, good nutrition, but he left out the teeth part. He didn't teach his students, including me, about teeth. And the reason why is because when he started practicing nutrition, he told his patients, go to the dentist, get your infected teeth pulled and the mercury taken out. So he crashed his practice. Everybody left his care. He had no patients left. They all went to the dentist. Of course, the dentist loved him, but that's why he didn't teach his clients like me about teeth, handling people with teeth. But I tell people, make sure your teeth are good. I send people to dentists. It's really important to get that cleaned out. I've had 2 patients, women with breast cancer. They did a thermography with a heat sensitive camera, and there was a trail of heat that went down from their mouth to their breast cancer site from the infection. So there was a question here. Do I recommend ERMI for the house? Yeah. Or testing yourself for mycotoxins? I recommend both. Test your house for mold using ERMI, and then test yourself for mycotoxins. What do you mean meat-based? Yeah, I include chicken and turkey and brats and pork and anything from an animal. Can vitamin B1 help with neurological issues? Absolutely, 100%. Seizures, maybe. Yeah, maybe, but seizures, you got to figure out the toxicity. And what's in the brain? What's in the nervous system